Hi, I'm Breanne St. Germain. The area that I surveyed was around the Aurora Tri-County Health Department building off of Colfax and Chambers. I thought it was a pretty interesting area. Around the intersection of Colfax and Chambers, it was mostly fast food restaurants. There was a Starbucks, and surprisingly, I saw a King Soopers right off of Colfax there. There were also two elementary schools about a mile away from that main intersection, as well as a middle school about a half-mile away and a high school about a half-mile down south down on Chambers. I think that this community had a couple outstanding assets. One, I think the community has really good access to public transportation, and it's walkable. So the location of the RTD 15 line is right there that runs east and west on Colfax, as well as the 153 and the 157 bus line that runs down north and south on Chambers. There's also a new R-Line light rail stop that stops along Colfax and I-225 next to Anschutz there, and it also has the 15 bus picks up at that stop as well, so that's easy access for people in that community to get to where they need to go if they don't have a vehicle. I also thought it was really interesting that this community has a lot of the new Lime bikes that are out that you see everywhere, which is a new rideshare service around town. But the only downside that I found to these bikes is that it operates off an app on your smartphone. So if you don't have a smartphone, then unfortunately you don't have access to using these bikes. Once you download the app on your phone, you get one free, ride, and then any additional rides after that, when you use the app, they're going to charge your debit or credit card that you have on file with them. So that's a little bit of a downside, but if people have access to those things, the rideshare Lime bikes is an option for them to get around as well. You can drop it off and pick it up wherever you need to. You don't have to put it in a bike rack or anything like that. Another asset for this community is that it is super close to a major hospital. University Hospital is about 2 miles away from that intersection. There's a major grocery store and schools locally accessible to these people in this community. I think the biggest challenge for this community, in my opinion, would be maybe the language barrier. It looks like it serves predominantly a Hispanic population, so for someone like me who doesn't speak any Spanish, it might be hard to be able to communicate effectively. I did notice that at Tri-County Health, the majority of the patient population is also Spanish speaking, so it's really nice that most of the people that work there are bilingual. The most striking thing about this community is, like I had mentioned before, that there is a King Soopers grocery store not even a quarter mile away from the intersection of Colfax and Chambers, which is easily accessible either from the bus or walking, which allows the community access to healthy foods. Let's see. Down the street, I also thought it was really interesting that the Aurora Mental Health Center is there. So I think that's an amazing asset for that community and a resource for people. It's a noticeable building. It's pretty large. It's just south down on Colfax, right before you get to 6th Avenue. They offer services such as individual and group therapy, behavioral health screening, diagnostic evaluations, and a couple other services would be a justice service, homeless services, and a program called Aurora Youth Options, which works with Aurora middle school and high school age students and families to help them navigate and connect to provide positive individualized resources for them to be able to be successful. And I think that's a cool resource for people in that community to have. The most unexpected thing that I saw, I think, was kind of the housing situation. There was quite a mixture of different housing types. I guess there were single family homes within the community in between, north of 6th Ave on Chambers, near where the schools were also located. So they were single family homes and a couple apartment complexes. Closer up to Colfax were more rundown Section 8 type apartment complexes. And several mobile homes that mobile home communities that I did not know existed in that community. or in that area. So that did surprise me a little bit. The community seemed in that area to serve maybe a little bit more of a lower class, so affordable housing might have been something that was a little bit difficult. I think my takeaway message from doing this project, I think you can gather a lot of information about a community by just doing a simple walkthrough or a drive-by. You're able to observe people in the community without them knowing that you're sitting there watching them. And you can see how the community works and the population of people that it's serving. I enjoy getting to know the community around my clinical site because it's not an area that I'd probably otherwise go to if I wasn't, going there for my clinic.